All right, guys, so since I won't be there for all of you this week to go through the rest of the skeleton, I figured I'd record a couple short videos to get you familiar with some of the bones. And this video is going to cover all of the bones of the upper limb, the arm bones. We're going to leave out the hand for now. We'll deal with that later. But I'm going to go over three specific bones in the upper limb. The humerus, which is the upper arm bone, and the two lower arm bones, the radius, which would be on the medial side, the lateral side, the thumb side in anatomical position, and the ulna, which will be on the medial side in anatomical position. So we'll start at the top. We'll start near the shoulder. This is the head of the humerus, which forms the shoulder joint with the glenoid cavity of the scapula. We went over that a little bit last week. And then we have, technically speaking, two different spots for the neck of the humerus. Right below the head right here, and I apologize for the glare, right there is the anatomical neck, the part directly below the head. And this part right here, where it starts to thin out a bit, is called the surgical neck. The reason for that is that when people fracture the proximal end of their humerus, they often fracture this end, and so this is where, or this spot right here, and so this is where it has to be surgically repaired. So there are two other landmarks on the proximal end here. One is on the outside, on the lateral side. We see a little bump right here. We see how it sort of flattens out here. That is the greater tubercle, and you'll only ever see tubercles on the humerus, by the way. This spot right here that sticks out the anterior end of the bone is the lesser tubercle. Those, as you might imagine, are really important sites for muscle attachment. Speaking of muscle attachment, as we go about halfway down the bone, we see that it sort of bulges out right here, and there's a little raised ridge right here in the middle. This raised ridge is where the deltoid muscle attaches, and so for that reason it's called a deltoid tuberosity. The deltoid muscle is the muscle on the shoulder that allows you to do this sort of motion right here. So if we were to be able to fly, we would use the deltoid muscle to do that, and it would attach right here. Its insertion, the movable part of that muscle, is right here on the deltoid tuberosity. So that's the proximal end. As we go down, we're still on the anterior side. Remember, we're still on the front of the bone. There's a lot to see here. The first thing I'll show you is some epicondyles. If you end up watching the video on the lower limb, you'll notice that the femur also has epicondyles. Those epicondyles are on the lateral end of the bone, and so, not the lateral, but on the outside surfaces of the bone. And so this side right here, where the head is, this edge, which sticks out a bit more than on the other side, is the medial epicondyle. And this side right here on the outside would be the lateral epicondyle. So the epicondyles, again, are right on the edges and are obviously important sites for muscle attachment. So we have a few other structures here. On the lateral side, the part that joins up with the head of the radius is called the capitulum. You see it's kind of a rounded projection right here. And that actually is responsible for the pivot joint that allows your elbow joint to rotate like this. You'll see that the head of the radius lends itself really well to that. Now, this part right here is referred to as the trochlea. Trochlea comes from the Latin word for pulley, and if we were to put a rope right through this, you wouldn't be wrong in saying that it looks sort of like a pulley. And so the trochlea here is the part where the ulna attaches. The ulna also inserts right here into this depression right here. This is called the coronoid fossa. And it's called the coronoid fossa because in the front of the bone, the coronoid process of the ulna inserts right here and prevents excess flexion of the elbow joint. And so as we go toward the back of the bone, there's exactly one more thing to find. That is the part that's labeled in blue right here. I just left that label on from a previous video. That is called the Olecranon Fossa. The Olecranon process of the ulna inserts in there and prevents excess extension of the elbow joint. So basically, that part of the ulna sits right in here and prevents too much extension or hyperextension of that elbow joint. Okay, so that's the humerus. Pretty simple. Now, At the elbow joint, the humerus joins with both the radius and the ulna. The radius, again, is on the thumb side of the arm. So this side right here, it's going to be on the lateral side in anatomical position. And this part right here at the proximal end is called the head. And the head of the radius looks like it lends itself really well to rotation, and that's exactly what it does. So the head is right here, which would mean predictably that the neck is right here. There's only one neck here, so not anything else to remember. And then we have here, this little bump right here, is the radial tuberosity, another site for muscle attachment. And so as we go down to the distal end of this bone, we have two landmarks to worry about. Here we have on the lateral side, or the medial side rather, we have the ulnar notch, and you can see it a little bit better from this angle. That is where the head of the ulna fits in on the distal side by the wrist. And also on the wrist, right underneath the thumb, is this part right here that sticks out that is called the styloid process. I warned you when we studied the skull that we'd have a few more styloid processes to go, and this is one of them right here. The second is coming in a minute. So that's the radius. On the medial side here, we have the ulna. Now, the way I like to remember the ulna and differentiate it from the radius is that the proximal end, the top of it, forms the letter U when you put it sideways. U for ulna. Now, I like to teach it from this perspective. This is looking at it from the side. This would be the lateral side right here. Actually, this would be the lateral side right here. And this is the most proximal part, which fits into the humerus, and this is called the Olecranon process. So we can see that this sort of forms the letter C. The top of the C is the Olecranon process. The bottom of the C, which sticks out a little further here if we're holding it straight up and down, is the coronoid process, which inserts into the front of the humerus. And then the area in between, which connects with the trochlea of the humerus, is called the trochlear notch. So there are a lot of very similar terms that you're going to need to take some time to keep track of with this unit. Now, the only other part on the proximal end here is right here. This little depression right here is where the head of the radius fits in, and for that reason it is referred to as the radial notch. So, as we go down to the bottom, there are two more structures here at the distal end, and they sort of look like a chunky pair of high heels, like maybe a platform pair of heels from like the 70s. The front of the shoe right here is the head of the ulna. This gets very confusing because the head of the radius was obviously at the proximal end. This is all the way at the distal end by the wrist. And right underneath the pinky finger is another styloid process. This one looks sort of like the heel part of a pair of high heels. So that is about it. The only thing I wanted to show you in addition to that is how the ulna fits in with the humerus right here. So we can see that this is the back. We see the deeper of the two depressions here, the Olecranon Fossa. That's how you know you're looking at the back of the bone. And the Olecranon process, which is the top of the C here, fits into that. So the way it looks from the side is just like this. And then we can perform that hinge sort of motion here. So from the back, we see that the Olecranon process collides with the Olecranon fossa and prevents excess extension. And we see from the front that the coronoid process, and it's a little hard to see from here, but the coronoid process fits into the coronoid fossa and prevents excess flexion, prevents the bones from getting too close together. So that's about it for the upper limb. Sorry I went a little long there, but I hope that's helpful. Thanks.